If the heart becomes diseased or weakened from non-disease processes, just wearing out, the heart won't keep up with the demands, and the pumping action will be ineffective. And the signs and symptoms that your client is experiencing congestive heart failure are paroxysmal nocturnal dyspnea. That's depicted here, where immediately awake and very often on the feet and gasping for air. PND, paroxysmal nocturnal dyspnea. We'll talk more about that when we get into the respiratory system. Dependent edema, we've talked about pitting edema. Fluid is retained in the periphery. Progressive difficulty in breathing dyspnea. Orthopnea, which means that if the person changes very typically to an upright and slightly flexed forward position, it improves their breathing. And then a condition known as ascites, which is not diagnostic for any one disease, but the retention of fluid in the abdomen. This is a picture of ascites. There's fluid just filling that cavity and distending the stomach. And then pulmonary edema, which has the symptoms of difficulty breathing, anxiety, nasal flaring, tachypnea, which is rapid breathing, and diaphoresis, which is sweating. When the heart begins to fail, it tries to compensate and keep up by these three things that are sequential. The ventricles get bigger, the ventricle walls get thicker, and the heart begins to go faster. And all of those compensations get made, and then there aren't compensations to be made, and the person is not able to clear their respiration, and they get a buildup of fluid in their lungs called pulmonary edema, which means that there's angina, there's chest pain because there's not enough oxygen to get to the heart muscle, and the kidneys cannot keep up with the blood flow, so that's where the edema comes from. This characteristic is not just related to congestive heart failure. It can be a result of respiratory distress as well, but not enough oxygen can lead to clubbing of the nails. It can lead to cyanosis, which you're way familiar with. This is a repeat, edema of the tibia. And then when there's cardiac distress, there can be changes in the skin, and I just for the sake of making sure that we've got this down, these color changes in the skin. If there's a purple patch that's kind of broad, it's called purpura. If there's fine little spots, it's called petechiae. And then this would be another sign. The person doesn't report a blunt trauma here that causes a hemorrhagic bleed subungually, but called a splinting hemorrhage. And then hypertension, too high blood pressure. I think, based upon what we've shared already, that if there is the arterial system is narrowed, then the pressure in the entire system goes up. If there's resistance at the liver or at the kidneys, then blood pressure goes up. There's other reasons, but I wanted to reiterate that hypertension is called the silent killer because the person may be asymptomatic. 50% of the people who have myocardial infarctions never had a symptom before they had their heart attack. And it's because their blood pressure got so high from a stenosis, an atherosclerosis, or there's a weakening in the vessel, and there's vascular accident where there's a rupture of the artery. But that's why we've got to participate with other healthcare professionals in monitoring blood pressure. So you see the different gradings out. A person who has marginal hypertension needs to measure their blood pressure frequently to make sure that it's trending downward, make lifestyle adjustments to get it down. If it moves here, if it stays consistently here, there's more pressure on the arterial walls, and aortal or cerebral vascular accidents can occur, and so forth. Called the silent killer. Signs and symptoms: that blood pressure's high, headaches, just feeling crummy, called malaise, visual disturbance where the person sees their pulse in their vision. I've been scared, and I went to bat early on in my high school career, and I'm looking out to the ball and I can see my pulse. So my blood pressure was up then, I guess. Inability to sustain physical activity. And then on the other side of the continuum is people who, because of illness, maybe bed rest. When you go to bed rest, your blood pressure tends to come down. And then there are people who are just prone to auto-regulation difficulty with the pressure of their blood. And if they stand up from a sit or sit up from lying down, they can get too low in their blood pressure and they can experience syncope, which is fainting. And obviously a secondary side effect of that is injuring other parts of their body, particularly the head. So the way to manage this until it's corrected medically or lifestyle, or if a person's not eating enough or they're immobile for too long and there's pooling of blood in their lower extremities. This happens in people who ride stationary bike. There's a big pooling in the exercising muscles that are, pumping the bike, and then they change postures and get it more erect, and there's a lag in getting blood to the head, and it can lead to syncope. Okay, so we'll be back to it. Okay, bless you. Bye.